Okay, hi, I'm Dr. Nelson at Freedom Healthcare, and today I want to talk about perimenopause and menopause. So women, this is for you. Let's draw a timeline here, okay? 30 years old, 40 years old, 50 years old. Let's talk about what happens to hormones and why women feel like they feel around the perimenopause and the menopause time frame, okay? First of all is estrogen. Estrogen fluctuates every month. Throughout the month it goes up and down, and then as we get closer to menopause, there's very few women who will get all the way to, let's say 50 years old is going to be menopause. There's very few women that crash down like that and just go instantly through menopause. That's incredibly rare. I'd say almost like I've never seen it. What usually happens is women, as they get around 45 or so, their estrogen is not fluctuating as high as it used to. And so they start to gain a little weight. It's more difficult to lose weight because estrogen is one of the best fat burners in the world. Their mood and energy is not as good as it used to be. And sometimes a little bit of foggy thinking because estrogen really helps with cognitive function. And then sometimes as we get closer to menopause, we'll see stuff like a crash for a month or two, and that's where you get menopausal symptoms, some hot flashes, night sweats, vaginal eye and mouth dryness, depression, weight gain, and then that can just be followed by a crazy spike in estrogen, and which will lead to maybe even up to a month of terrible PMS, water retention, breast tenderness, irritability, and then that'll come back down and be normal for a little bit and crash. You know, it can do all kinds of crazy stuff before it finally goes through full menopause. This is why the real definition of menopause is an entire year with no ovulation, okay? Now, we don't treat with estrogen until after menopause almost entirely. There's very few reasons why we'll give estrogen here, occasionally, but estrogen is afterwards. Now, bioidentical estrogen versus synthetic estrogen. Most women have heard of Premarin. That is, it actually stands for pregnant mare urine. They take the estrogens out of pregnant mare urine and they isolate them and they put them in a pill and give them to humans. Now, these are not human estrogens. So they have non-human, non-normal reactions at our receptor sites. I don't prescribe Premarin just for this cause because it increases blood clots, and in some women it can increase the risk for heart attacks. It does not increase breast cancer. In fact, Premarin and even natural estrogen add a little bit of protection from breast cancer. I use natural estradiol, which is the natural human hormone which lowers blood clots and lowers breast cancer risk and is natural to the human estrogen receptors. Okay? Both medications have been available for decades through regular pharmacies, Walgreens, Smiths, you name it, wherever. They've been available for decades. Let's talk about perimenopause, because this estrogen is mostly around the menopause time. Let's talk about what happens to progesterone and testosterone. Progesterone also fluctuates every month, and then women oftentimes around age 35 to 40 will start to lose their progesterone, and it'll be quite low. And that's what's called perimenopause. Perimenopause can be up to a 15-year event in your life. So what happens when women lose progesterone? Progesterone is incredibly good at reducing Alzheimer's. It's very protective to your brain. Progesterone is incredibly good at reducing breast cancer and uterine cancer, and progesterone is what builds bone density. It actually stimulates the cells that build the bone, where estrogen helps bone break down slower. So women oftentimes will lose progesterone. They get to age 50 and they wonder why they already have osteopenia or osteoporosis. And the reason is because they've lost their progesterone much earlier. Another sign of low progesterone is difficulty losing weight, poor sleep, skin, hair, and nail changes, and also heavy bleeding. I can't tell you how many times I've had women come in who have said they've ended up with a hysterectomy or a uterine ablation because of excessive bleeding as they get older. So they go get this uterine ablation and they go get the hysterectomy, and great, that solves that problem, and that's great. But it doesn't solve the reason for the bleeding. And the reason for the bleeding is also the reason for a higher risk for breast cancer, Alzheimer's, osteoporosis, and even uterine cancer. So progesterone is a protective against all of that. And then I get the question of women, they say, well, I went to my doctor and they said, you've had breast cancer in your family, so you have to stay away from hormones. And I agree with that doctor if we're talking about synthetic hormones. The synthetic progestins that are in birth control pills and Provera, the most commonly used postmenopausal progestin, absolutely proven they increase the risk for breast cancer and blood clots. Every study to date with progesterone, the natural one that your ovaries make normally, shows a reduction in blood clots and a reduction in breast cancer. So it turns out the kind that nature invented is very good for women. The kind that we've chemically tweaked and put in birth control pills and Provera is actually bad. And so I will always prescribe natural progesterone, which, by the way, has been available at regular pharmacies for decades. And by just replacing that progesterone, women sleep better. They stop bleeding. Their mood and their energy and their skin and hair and nails are all improved. So that's progesterone. Now testosterone. Here's an interesting fact. Most doctors, including myself in the past, don't realize that women's ovaries actually make more testosterone per month than estrogen in your 20s to 30s. So testosterone is vital for women's health, and their ovaries make it. So testosterone also takes a downward turn around mid-30s and is very low. Well, testosterone in women does the same thing it does for men. It improves fat burning. It improves muscle retention, mood, energy, enjoyment of life, just your overall well-being. And when you start to lose that, then you gain weight. Midlife mood problems happen. And oftentimes people will be put on psychiatric medications here, and those are fine. That's I don't have a problem with those. But if a woman never had a problem with anxiety or depression up until around age 40, I don't think she all of a sudden developed a Prozac deficiency. But I know for sure she developed a progesterone and testosterone deficiency. Another fact about testosterone is in women, testosterone kills breast cancer. And there's actually breast surgeons who will take out a known cancerous lump and put in a testosterone pellet to have a high concentration of testosterone for the next 2 to 3 months in that area to help prevent any recurrence. So that is the story of perimenopause and why women have the symptoms they do of weight gain, mood changes, anxiety, poor sleep, excessive uterine bleeding, and how to fix the problem with natural hormones that do not have side effects and do not cause problems because they are natural to the human body.